Hello everyone and welcome to BoardWalk. Today we will be covering the lysosomal storage diseases, a group of complex disorders that pose diagnostic challenges due to their complex biochemical pathways and diverse clinical presentations. But don't worry, we'll break down these diseases and help you remember them with our visual mnemonics. To begin, lysosomal storage diseases are a group of rare, inherited metabolic disorders caused by defects in lysosomal functions. When specific degradation enzymes are deficient, substrates begin to pile up in the lysosomes of cells and cause a variety of problems. Majority of these disorders are autosomal recessive, but a couple are X-linked recessive, which we will make clear in our images. The diagram at the bottom shows the biochemical pathways of the relevant substrates and enzymes that lead to the production of ceramide, a bioactive lipid at the center of sphingolipid metabolism. This may seem complicated, but our images should help you remember the most important points so you can get some easy points on test day. Let's start with our first class of lysosomal storage diseases, the sphingolipidoses. Alright, so the first lysosomal storage disease we will cover is Tay-Sachs disease, and we will title this image Tay versus the musculoskeleton boss. Here we have a young rebellious boy named Tay who is playing a horror game called Hyperflex. He has Tay on his hat to help you remember Tay-Sachs disease. He's very young and shouldn't be playing such a scary game to begin with, which helps you recall that this disorder presents in infancy with developmental delay. His ears are huge and on backwards for some reason, which signifies hyperacusis. This presents as an infant having a startle response to loud noises. Looking at the skull boss in the video game, we can see that he has bright red eyes. This signifies the cherry red spot seen on the macula, which occurs due to lipid accumulation in the ganglion cell layer of the eye. The skull's brain is exposed, signifying the neurodegeneration that occurs in these young patients. Also, look at the skull boss's bulky, flexed biceps. He's clearly been hitting the gym and getting his protein in. This, along with the game's name Hyperflex, should help you remember that Tay-Sachs patients have hyperreflexia. Now, let's move on to biochemistry. At the bottom of the screen, we can see that Tay is on his second life in the game, hence Game 2. This should help you remember that GM2 ganglioside is the substrate that accumulates. Also, look at that cool hexagonal wall pattern. This represents that hexosaminidase A is the deficient enzyme. Remember, hexagonal wall pattern, hexosaminidase A. Now, moving on to histology, look at those onions on the table. Tay may have little regard for ESRB game ratings, but he does not skimp out on his veggies. These onions signify the onion skin appearance of lysosomes on histology. You should look up a picture of this to familiarize yourself with it. So here's a summary slide covering all of these points. I hope that this first image helped you, and let's move on to our next visual mnemonic. Now we will cover Fabry disease. This image takes place in a busy shopping mall with our fabulous Queen Fabia and her chore boy. Hence, it is titled Fabia's Fabulous Bizarre Day. So she knows she's looking fabulous, which should help you remember Fabry disease. We can also see her thoughts, and look how fabulous is spelled, with an alpha and an A. This may seem like a bit of a stretch, but it should help you remember that alpha galactosidase A is the deficient enzyme. This is the only enzyme out of these lysosomal storage diseases that starts with an alpha symbol, so it's a good differentiating factor. Moving on, look at her purse with a gigantic trihexagonal emblem on it. Remember that this is 3 hexagons to recall that ceramide trihexoside is the substrate that accumulates. This gaudy emblem also embellishes a super expensive brand, XLR. This signifies that the disease is inherited in an X-linked recessive pattern. Let's move on to the clinical presentation of this disease. We will represent the classic triad of symptoms with Fabia's chore boy, Fabio. His shirt is covered in red polka dots, representing papular skin lesions called angiokeratomas, which occur due to capillary malformations. Next, he is holding an empty water bottle, which represents hypohidrosis, or low sweat production. Lastly, he is a young man using a cane. This represents early peripheral neuropathy. There are also some late manifestations of Fabry disease to be aware of, including cardiovascular disease and progressive renal failure. This is shown with the mall advertisements telling people, have a heart, donate a kidney. Here is a summary slide for your review. I hope Fabia's fabulous day at the bazaar helps you remember these important points about Fabry disease. Now let's move on to metachromatic leukodystrophy. This image, titled Metabot's First Day in the Sausage Factory, takes place, of course, in a sausage factory operated by our Metachrome robot friend here. This should help you remember metachromatic leukodystrophy. He is slicing up sausage links, signifying the central and peripheral demyelination that occurs in this disease. He shouldn't be cutting up the sausages, but he appears to be confused and losing coordination. I mean, it's his first day on the job. Let's cut him some slack. His confusion and miscoordination represent the dementia and ataxia seen in these patients. We can see an odd poster behind him that says Cebro, a real sulfate. This kind of sounds similar to cerebroside sulfate, which is the substrate that accumulates. Aryl sulfate specifically should help you remember aryl sulfatase A, the deficient enzyme. So this was a shorter one, but I hope you enjoyed. Here's our summary slide for your review. Moving on to crab disease, this image is titled Cranky Crab's Intergalactic War on Sausages. Our obvious protagonist for this image is a crab, an angry crab, at war with hundreds of thousands of relentless sausagelings floating in outer space. Let the outrage and fury of this crab make you think of him as going psycho, to remember that psychocine accumulates in lysosomes. Similar to metachromatic leukodystrophy, this is a demyelinating disease. Let his blast attack on the sausages help you remember that crab disease specifically involves destruction of myelinating cells and causes peripheral neuropathy. Cranky Crab's Galacta spaceship should dually remind you that galactocerebroside accumulates and galactocerebrosidase is the deficient enzyme. In the distance, we see a large purple planet, or globe. This should remind you of globoid cells that are characteristic on histology for this disease. Globoid cells are large, multinucleated macrophage derivative cells found in the white matter of the central nervous system. So that wraps up this image. Also a short one. I hope you enjoyed. Now we will move on to Gaucher disease, with this image titled Gills-Gauche love letter. It's important to note that this is the most common of the lysosomal storage diseases and occurs at a significantly higher rate in people of Ashkenazi Jewish descent. In this image we have Gil, a young boy who has a huge crush on this girl next to him. But he doesn't know what to do about it. He's too awkward, or gauche, to approach her. This should help you remember Gaucher disease. As we can see, this young man has red, twisted snake tattoos on his leg. Hopefully those are temporary tats, but who knows these days. These red snake tattoos should remind you that these patients can experience avascular necrosis of the femur, bone crises, and/or osteoporosis. These problems can make it difficult and painful for the patient to ambulate, so look out for that in a question stem. Gil also looks like he just got out of a mud fight during recess, with large liver and spleen-shaped mud stains on his shirt. This signifies the hepatosplenomegaly that occurs in this disease. We also see a rusty red pan on Gil's desk, representing the pancytopenia that can occur due to splenic sequestration and bone marrow infiltration. Also, on his desk, and now all over the floor, are failed attempts at asking the girl on a date. He crumpled up and tossed all these love letters, representing the Gaucher cells in this disease that are lipid-laden macrophages resembling crumpled tissue paper. I recommend looking up a picture of this to recognize the histology for easy exam points. On the girl's desk, we have a flask of glucose solution. Glucose should help you remember that glucocerebroside accumulates, and glucocerebrosidase is the deficient enzyme. So that pretty much covers everything for Gaucher disease, and since this is the most common of the lysosomal storage diseases, it is one of the higher yield ones. I recommend you spend some time understanding the clinical picture of Gaucher disease so that you can get these questions right. Here's our summary slide, and good luck. Now for the last of our sphingolipidoses, we will cover Niemann-Pick disease, with this image simply titled Niemann Picks His Nose. Here we have a child, named Niemann, working in a coffee shop, and he's picking his nose. Maybe we shouldn't allow children to work in the fast food business, but that's just my opinion. Let his youth remind you that this disease occurs very early, presenting in infancy. Now, when you say picking his nose with his finger, think of sphing for sphingomyelin, the substrate that accumulates. You should also be able to remember that sphingomyelinase is the deficient enzyme in this disease. Looking at his coffee mug, we see it has a spooky skull design, kind of similar to the skull we saw for Tay-Sachs disease. This skull also has cherry red eyes, representing the cherry red spot that's seen on the macula. Now, this is a common sign we see with Tay-Sachs disease, so make sure to differentiate the two through other clinical signs. For example, Tay-Sachs disease presents with hyperreflexia, while Niemann-Pick disease presents with hyporeflexia. Additionally, Niemann-Pick disease patients have hepatosplenomegaly, which can be noted by the liver and spleen-shaped coffee stains on this kid's apron. Moving on, the skull's exposed brain represents the neurodegeneration that occurs. The foamy whipped cream on top of the coffee represents the foam cells seen on histology. These cells are lipid-laden macrophages. So that pretty much covers everything for Niemann-Pick disease. Especially remember the mnemonic, Niemann picks his nose with his finger, and that alone should help you with exam questions. So here's our summary slide, and good luck. We will now discuss the two mucopolysaccharides that you should know, Hurler syndrome and Hunter syndrome. Luckily, these are shorter ones and maybe not as high yield as some of the previous diseases. We will first cover Hurler syndrome. This image is titled The Spooky Bowl, where the skeleton Bony Jabroni just threw a last-second pass to D.D. Racula the vampire. Think of the football hurling through the air to remember this scene for Hurler syndrome. As the vampire gets ready to catch the ball with his hands, think of this as if he is trying to obstruct the ball as it is flying through the air. Consider this an airway obstruction, if you will, to remember that Hurler syndrome patients may have an airway obstruction due to anatomical problems, such as skeletal abnormalities. You can remember that these patients have skeletal problems by remembering Bony Jabroni standing in shock, worried that his pass won't be received. His entire football career is flashing before his cold, empty eyes, remembering the nearly career-ending head injury he suffered back in '06. Sorry, that got really dark, but let the brain exposed from his past injury help you remember that neurodegeneration and developmental delay are associated with Hurler syndrome. Next, look at the mud stains on D.D. Racula's jersey. They're conveniently in the shape and locations of the liver and spleen. Let this help you think of hepatosplenomegaly. In the clouds, you can see the creepy eyeballs watching from above, tuning into the largest sports event in Spookyland. Let these eyeballs in the clouds help you remember that these patients have corneal clouding. Next, look at the brand name on the football, Alpha L. This is because alpha L iduronidase is the enzyme that accumulates. Lastly, the gargoyles on the sides represent that this disease used to be referred to as gargoylism, but this is a historical term and probably won't show up on exams. So that wraps up Hurler syndrome, and here is our summary slide. Moving on to Hunter syndrome, we have this image creatively titled The Hunter. This is self-explanatory, but this should help you remember that this image represents Hunter syndrome. Our hunter is very angry and aggressive, helping you remember that these patients may have aggressive behavior. Additionally, our hunter is wearing a garlic necklace to ward off vampires. Refer to our previous image for Hurler syndrome in which there was a vampire, D.D. Racula. This should help you remember that Hunter syndrome presents as a milder form of Hurler syndrome. Also, as you can see, it's a clear, sunny day in this image. This means that there's no corneal clouding in Hunter syndrome, which may be a useful differentiator in a question stem. Looking at the hunter's words, we can see why he's angry. He missed both of his shots. Think of him saying, "I don't know how I missed two," to think of iduronate 2-sulfatase, the deficient enzyme in this disease. Lastly, look at both the hogs marked with the letter X. This represents that the disease is inherited in an X-linked recessive fashion. You remember which other lysosomal storage disease is X-linked recessive? If you're thinking of Fabry's disease, you're correct. Other than that, there's nothing really left to know for this disease. Here is our summary slide for your reference. This concludes our chapter on the lysosomal storage diseases. I hope that this has been a very helpful experience for your learning of these complex genetic disorders. Good luck and happy studying.